Good evening, and we'll call to order the general board meeting of the Oakland Community Health Network. At this time, I would ask if you can, please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty. Could we have a roll call of the members?
Mr. Young.
Here.
Mr. Furman.
Present.
Dr. Giles. Pastor Jones.
Present.
Dr. Guadalupe. Present. Ms. Woodruff.
Present.
Dr. Hans.
Yes, present.
Ms. Newman gave prior notice. Ms. Root.
Here.
Ms. May.
Here.
Mr. Torres. Mr. Cowan.
Present.
You have quorum.
Thank you. Next, I would ask the board for approval of our board meeting agenda. We have not been aware of any additional matters to be added to the agenda this evening. So moved. Support. Moved and supported. Any discussion? All those in favor say aye.
Aye.
All those opposed, the motion carries. We have an agenda. Next is our first opportunity to public comment. Usually our general procedure is to first go with the online and then with those who are present, and I do have 3 individuals who have signed in, but if others have come late, we can recognize you. We ask that you please limit your comments to 3 minutes and please address the board, and we thank you for your interest and for your attendance. So at this time, is there anyone online?
If you are online and wish to speak for public comment, please raise your hand at this time.
There's no one asking to speak online, so we'll go to the is there just one? Okay. Kristen Elliott? Yes. I hope I got that name right. Okay. Thank you.
Hi, my name is Kirsten Elliott, and I'm the president of Community Housing Network. Community Housing Network has been a partner agency with OCHN for almost 24 years. And I am here tonight to announce that, if you haven't heard yet or if you don't know, Mark Craig, our current founding CEO and president, is retiring. Mark has not only been at Community Housing Network and founded and led us to create an organization that has been able to leverage many of the resources that with OCHN, but to provide thousands of units of housing for people receiving services through OCHN. But Mark has been part of helping to deinstitutionalize many of the institutions in Michigan, and was pivotal in helping to create community-based settings for people. He worked at Mork for 23 years before he came to Community Housing Network and worked for 24 years. So I am here just to officially invite the board and all of the public, if you're online, I am to invite you to our retirement party. We're having it on October 3rd from 5 to 8 here in this room and in the atrium. Our offices are upstairs. So I just wanted to invite everybody to honor Mark and the contribution that he has made to this community and making sure that we have inclusivity for all people, no matter what your ability is, so that we can live fully included in the community. So that's it.
Well, thank you for coming and inviting us.
You're welcome.
And I think everyone will check their schedule. We know where the place is going to be.
Yep, sure do.
I would just like to join Mark on where he's going to be with that sunset.
Yeah.
It looks pretty good.
Yes, definitely. Well, he has a tiki bar at his house. He lives on Lake Orion, and that's what he says he's doing.
That doesn't. I don't know of any palm trees on Lake Orion, and I know a lot of people who live there. But that's okay. No, thank you very much.
Thank you so much.
Okay. Is there anyone else who wishes to address the board who's here this evening in person? Okay. I was incorrect. There was only one person that signed up, not three. I had an old sheet. So that being said, we'll move on from public comment, and we'll move on. And our first item, really not of business but of celebration, is oh, you know what? We'll change the order. Come on up. That's all right. That's all right. But this also is a celebration on stories that inspire. And we have Sabrina Sassine, who's a peer recovery coach and supervisor with Meridian Health Services. And we appreciate you coming this evening. I think Trish is going to do a little introduction.
Absolutely. Thank you. As you all know, September is National Recovery Month. This Friday, we will have our recovery celebration right here in our parking lot. And I believe we are close to almost 600 attendees for that. And so in honor and to continue our celebration of Recovery Month, we have Sabrina Sassine here, who is a peer recovery coach supervisor at Meridian. She also sits on the adult treatment court, and she is here to share her story. So welcome, Sabrina.
Hi, thank you. I'm Sabrina. I've lived in Oakland County most of my life, and I think it's really cool that I, get to come back and do these types of things, and I like to give back, and I am looking forward to seeing you guys on Friday. So this time of year is always really interesting for me because I'm coming up, it's my sober anniversary, so in November I'll have 7 years sober. And to share a little bit about, what my life looked like 7+ years ago, I grew up pretty, normally I drank with my friends, these types of things. And I went to school for teaching, high school history and social studies. I don't teach because you can't teach and be a felon in the state of Michigan. But, that was what I was doing. And in my early 20s, I married someone that had a really bad drug habit. And I didn't know anything about it. This is a long time ago. So, I didn't know what was available. I didn't understand what addiction was. I just watched someone go through it. And then as the years went by, if you can't beat them, join them. And so in 2016, he died of a drug overdose while I was at home. So that was not so fun. And you would think that would help someone get sober. It didn't. So, I was left in a place where I had lost my best friend, and, I had a bad heroin habit that then turned into a bad heroin and crack cocaine habit. And it wasn't too long before Oakland County sheriffs picked me up on any number of, things related to drugs and alcohol and using drugs and alcohol. Hence the felony record. So I have not a short amount of felonies, and I did not a short amount of time in jail. And I share that because, like I said, if you don't know where I was, it's not so cool to hear where I am now. Anyways, so I do all this time in jail. And meanwhile, I've never tried to get sober. I've never been to rehab. I still don't really understand addiction. I just know I'm an addict. And I do all this time in jail, and I get out, and I try to manage it and all these things, and that's not what happens. And so in 2017, I got a DUI because I knew the drugs were bad, but I thought, the drinking is fine. This is probably fine. Not fine. So November 2017, I got a DUI, and that's actually my sober date. And I wasn't concerned about the DUI because whatever the consequences of that were not going to be worse than what I had already done and, what I was facing for violating this Oakland County judge's felony probation. And for not a small amount of felonies either. And so, but, I thought, I remember that night, and it's like, if I don't do something else, this is going to be the rest of my life. And at the time, I was 29, so I was like, there's got to be more than this. Life is long. There's got to be more to it. And anyway, so that judge, I got sober, stayed sober, and I'll talk about that in a second, but that judge ended up giving me adult treatment court, which is one of the courts that I now get to sit on. So I think that's pretty cool. I'm their peer recovery coach, so a lot of full circle things, and I don't know, there's something real nice about that. But I did. I got sober and I stayed sober, and there wasn't one method that I used. You know, I did MAT services and then successfully tapered off of that. I did mental health services. I went to therapy. I went to meetings. I got a peer recovery coach. You know, and I remember, you know, I'm a few years sober. I've graduated drug court, and I wasn't working. Luckily, you know, my mom was very supportive, and I was still scared to kind of have my own money in my pocket. Also, I remember thinking, like, man, you know, with the record I have and all these types of things, like Taco Bell's not even going to hire me. Like, this is terrible. But I still kept going. I did a lot of volunteering and this and that. And then, actually, you had mentioned her. I ran into Heather Willis at a training, and she had sat on ATC, and I had, you know, was messaging her during the training or whatever, and she got me in touch with Meridian, who happened to be hiring in their MAT and outpatient, and I was in luck because it was meant to be a 50-50 split between their outpatient and the courts, and that's what I did for the last 3.5 years. And then in July, I got promoted to supervisor, so now I supervise all of Meridian's peer recovery coaches, which is 6, soon to be 7 people. I still sit on the courts. Randomly, I sit on the District of Troy's sobriety courts as well. And, you know, I don't know, a person being in recovery, working with other people working in recovery, you know, it's so interesting. And I don't know, like I said, it's hard to fit it all in a short amount of time, but I hope it gave you a glimpse into, you know, the possibility of turning a frown upside down, because I feel like I've done that, and I'm still doing that. And I think that's all I've got, so thank you.
Well, thank you very much for coming and sharing your story with us. You've had a road that you've gone down, and we're glad you're helping others with their addictions and issues, because there's nobody better to deal with it than somebody who's been through it, such as you. So we appreciate the commitment you have to the people that you serve. Does anyone have any questions or comments? Or?
I just wanted to make a comment.
Sure.
Thank you so much for coming in today and sharing your story, because your story will inspire others who are on their journey towards recovery. So,
Thank you.
It's always good when one can help another.
I try.
Okay. Anyone else?
Congratulations to you on your recovery. I appreciate you sharing your journey with us. It's a lot to come up and share that with those that you work with. So it's important for us to hear, like my board colleague said, because you can definitely change the lives of others through your lived experiences. So thank you for sharing, and congratulations.
Thank you. Thank you guys for having me. I really appreciate it.
We call this segment Stories That Inspire Hope, and you certainly have inspired hope for all of us. So thank you very much, and congratulations.
Thank you.
All right, now another celebration. Vicki Suter, if you would come and be seated. Vicki is not here to make a presentation tonight, so she's very relieved. Look at how relaxed she is, and just...
I do have a speech.
Oh, okay. All right. And for 35 years of service, you don't have any time limit, so you could fire away at will. Vicki Suter has worked in the public mental health field for 35 years, with the past 12 years serving in the role of Rights and Advocacy Director at the Oakland Community Health Network. She is one of the original founders of the statewide Walk a Mile in My Shoes rally at the Michigan Capitol in Lansing. Is that today? Yes. An event that highlights the need for increased funding for mental health services, raises awareness of mental health needs, and works to eliminate behavioral health stigmas. The 20th anniversary is being celebrated next week, with Vicki serving as one of the guest speakers. Vicki was also the longtime chairperson of the Community Mental Health Association Public Relations Work Group. Eliminating stigma for those receiving behavioral health services has been a high priority throughout Vicki's long career. These efforts led to the establishment of Oakland County's Begin Ending Stigma Today BEST group, a team of dedicated representatives from OCHN and its provider agencies. The BEST mission is to create a stigma-free culture in Oakland County. Vicki also leads a strategic planning work group whose members include persons served. This group is instrumental in identifying community and network behavioral health needs. The compassion and commitment to ensure the voices of persons served are heard, and among the many reasons why Vicki was awarded the 2024 Dove Inclusion Leadership Award from the ARC of Oakland County. As a lifelong advocate to protect the interests of individuals served by the public mental health system, Vicki is actively engaged in the community and works tirelessly to create change, especially as it relates to stigma reduction. We commend her as she celebrates 35 years of service with the Oakland Community Health Network. We thank you for your compassion and your dedication, and please join me in congratulating her on this amazing recognition.
Thank you very much. I appreciate that. I'm going to try to sum up 35 years in about 90 seconds. So you experience lots of things when you've been at an organization for 35 years. And I was pink slipped once, way back, probably in the 90s, because the state was cutting funding, and so they had to cut some staff. Fortunately, the state pulled back, and they didn't cut that funding, so I never got laid off, thank goodness. I also was reorged out of a job twice. I started when I started with Oakland County Community Mental Health in 1989. I started out as general clerical, and I was working on my bachelor's degree, so I worked in a children's day treatment program. I also became the office manager of that program. I worked in billing, back when you used to have to type up your billing for Medicaid and send it to the state. Makes me sound old. I worked in contracts. I worked in finance. I love finance still. I worked in human resources. I was the community and education outreach manager, and now the director of rights and advocacy. I've been blessed with some incredible coworkers and some great bosses who were mentoring me, who provided me opportunities to do a number of things. I have an MBA from Wayne State University, and I believe most of that MBA was through tuition reimbursement here. I graduated in 1997, so I think you got your money's worth out of that tuition reimbursement. And all those things happen, you know, from great support from bosses and coworkers, and certainly my family, and my husband, and John is here with me today. But I want to sum up and say thank you to God for leading me to this path of this career. It's been incredible. Anybody that's worked with me for any length of time has heard me say, and I honestly do mean this, I love this job. I always have. Even back when I was in general clerical, love the job. Every job I've had, I loved working for this organization. I love the mission. I love the things that we do. I also want to thank the board for honoring me today. I want to thank OCHN for providing me just one fantastic career. It's not ended yet, unfortunately. I'm not quite ready to retire. And also, most importantly, I want to thank the persons that we serve for letting me be a part of their life and for providing me with the best education I could ever get. So thank you.
Okay. Two things. One, I know Melchiah Newman is going to regret missing this, but she is at a conference in the training, and I know that she has worked with you and on a lot of stigma issues, so I know that she sends her congratulations. And also, John, would you raise your hand so we can recognize you? Behind every great woman is a man who's helping. And John, you are that man. Thank you.
Thank you.
All right. Okay, now we'll move on with our business after two really amazing segments of our meeting tonight. So first is reports, and my report is simple. I did meet, I wanted the board to know, I had an opportunity to meet Dana and I with our incoming CFO, Robert Blumfeld, who will be joining us on Monday. And we look forward to him joining us. He has a long history and experience in the provider network, which translates easily to us. He understands how the accounting works in this organization. So we look forward to him joining the team and leading and giving a strategic vision to our financial future. So we look forward to him joining us. Mr. Young, on behalf of the Finance Committee.
Thank you. At the COW meeting of September 9th, we opened with a CMHA update and legislative briefing. Lobbyists highlighted the need for advocacy for releasing budgeted state funds and also school funding for mental health. Next, we had a financial update. Patrick's going to give two reports in a couple of minutes here for board approval. One on Budget Amendment 2, and then presenting the annual budget. So we'll have a little bit more detail in a few minutes.
Thank you very much. And Yvette Woodruff on behalf of the Policy Management Committee.
There were two items under policy management on the committee of the whole agenda. One was presented as an action item that was presented by Ms. Frances Carlin, Director of It was the 24-25 annual plan. There was a recommendation from the committee to support it. Agenda for final. Second item that was received and filed was from Ms. Megan Phillips, the Director of Substance Use Disorder Services. It was an update of the strategic plan for the years 2024 through 2027. Includes the items that were discussed under policy management, committee of the whole meeting on the 9th. Respectfully.
Thank you very much, both you and John, for those reports. At this time, we'll now move on to kind of our regular business items. Board approval items are 8, including 4 contracts. All of these matters require a roll call vote. So the first item is if Patrick Franklin would please come forward to discuss Budget Amendment 2.
Good evening. So last Monday we presented Budget Amendment 2 as well as FY25 budget. I don't know if there's a document to share this for the screen. Okay. So we added an additional, we actually reduced the revenue for Budget Amendment 2 by $20 million based on the revenue that was projected that we did not receive. So we had to adjust our revenue to match what our actual revenue was based on the $94 million that was projected throughout the state and our share of that amount that was budgeted prior. So we had to pull that out of the revenue that we had previously budgeted for. I know there's discussions and talks that there's a possibility that they will review it with further direction later, but right now we went based on what information we had and the actual revenue received. So as you see, you can see a $20 million reduction in BA2 from the budgeted amount that we presented in Budget Amendment 1. Budget Amendment 1 showed a $7.4 million deficit. Budget Amendment 2 shows a 15.6. And so the other revenue reduction was the CCBHC. We had mentioned before that our CCBHC revenue higher than what it actually came in at, and we had to reduce that amount as well. There were a couple of expenses that we adjusted up as well. One was prior year cost settlement amount that we did settle with the state from FY21, and also were some other cost settlement expense related items that caused our expense to go up slightly as well. And so those items brings our total shortfall for fiscal year 24 for this BA2 amendment to $15.6 million. So I'm going to allow Nian to share the Budget Amendment 25 highlights because she presented it at the COW. I did want to mention that the final rates for budget for FY25 have not yet been finalized. They have not been released. They were told we would have them Monday, but as of today, we have not yet received the finalized FY25 rates.
Okay, let's take these one at a time, I think.
Yeah,
Right?
let's do the Budget Amendment 2 first, and this, for those in the public and who are here tonight, we had an extensive discussion on this at our last meeting, and the ins and outs, but as you have heard, there is it 93 million that's tied up with the state? 94 million that has been budgeted and has gone through all the rules and regulations it needed to at the state level, but it has not been released.
Correct.
And we don't really have a good explanation, and I won't speculate on that, but having been around for a while, it could be that maybe that money's going somewhere else. I hope not, and we're advocating that that money be released to not just us, but to other networks and other providers who are part of that $93 million. So as you heard, that's a $10 million hit right now because we can't count money we don't have or don't expect to have right now. But hopefully something will happen with that money. If not, the end of this fiscal year, maybe at the beginning of next year, which would probably be retro, but we'll figure that out as we go. So we do have to pass a budget amendment, though, so that we're in line with our financial rules and regulations.
So I'm going to move for approval for FY24 BA2.
Support. A motion and support. Is there any discussion? Roll call vote, please.
Yes.
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 Thank you.
Okay, thank you. The next item now, if you want to proceed with the 25 budget, 24-25 budget, I do want to mention that the request, even though we do not have the rates, which is, well, I'll hold my comment on that. But the state does know that we're all budgeting right now, and we don't have rates. So we're doing the best we can as a forecast. Most likely, we're going to have to adjust this budget once we get the rates. But we have to pass a budget because all governmental entities need to have a budget by the end of their fiscal year. So we've only got less than 2 weeks left. So we will need to pass this budget tonight. All the other items we did have information on and have been projected to the best of the ability of the finance department. And we did discuss this last week, and we also had discussions with the finance committee and the finance staff in the last couple weeks about the budget. So I'm going to turn it over to our finance chair, Mr. Young, on this.
Thank you. Proceed, please.
Hi, Nan Bland, and I'm just going to give a very high level. Again, thank you, Mr. Cowan, for that, and Patrick mentioning that we do not have the revenue rates in order to really and truly factor them in this budget like we like. So for the FY25 initial budget, you'll note that we are revenue-wise coming in approximately the same area at $486 million, where we actually project ending for FY24. Now, you'll notice that for our expenses, we have in total our expenses coming in at 484 approximately million for the year. Now, there are three major areas that are impacting the decrease in our cost and our projection. One being administrative rates, taking into consideration, the looking to align more with de minimis and looking at internal and external factors to decrease costs there. The second area will be pulling in service lines. For example, our FMS, our financial management services, transportation, and our self-determination services, bringing those back in-house. We're looking at a decrease in costs there. A third would just be our overall management efficiencies that we have in the works and plan for a cost reduction expense decrease for next year as well, impacting us at a resulting $2.5 million surplus projection in this initial budget.
Okay.
That concludes.
I'll make a motion for approval of the FY25 initial budget, assuming we're probably going to see a BA in December.
Support. Is there any discussion with the board? Yes, Christina, yeah.
I just wanted to ask if you feel you took a conservative approach, even though we don't have the rates. I was trying to figure that out.
Absolutely.
Okay.
Yes. This is all within a very conservative spirit to this initial budget.
Okay.
Thank you for that.
Yeah, I think that's a good question. We had quite a bit of discussion, kind of beginning and the end of the Cow meeting, and it is, as Mr. Cowan said, that this is flying a little bit blind, given, it looks like redetermination is over. The numbers we heard were staggering in terms of the number of individuals who were either no longer on Medicaid or were in the lowest form of reimbursement. Just the fact that they haven't set the rates and we are in the final minutes of the fiscal year, it's, I thought higher ed budgets went down to the wire, but this one kind of sets a new standard. So thank you for your work on that.
And just for the benefit of those who are here or listening, this budget is basically a break-even budget because we really can't make a lot of plans until we know what these rates are and how we're going to proceed. So I want to thank the finance department for doing the best they can under adverse circumstances. It's interesting. We're required to have a budget to submit to the state, but they're not required to give us the rates in time to formulate a reasonable budget. So maybe we got to correct that somehow. Remember that saying, there ought to be a law? Yeah, this would be a good one. And this is just so we can plan with our provider network on what we're going to have, because we can't spend money we don't have. It's just a simple fact. And we have stretched our reserves in the last 2 years through COVID and trying to assist our providers and those we serve, but we don't have that reserve kind of level anymore. So it's going to be whatever we get, that's what's going out the door and nothing more. So that's why it's a little disconcerting that we don't have these rates and be able to plan appropriately. So, but that being said, we pretty much got through this past year not in too bad a shape, all the factors considered and all the changes in funding and the decreases in funding that we got through, I thought, pretty well until this past week when we realized, we can't count that $10 million because we don't have it yet, and we may not get it before the end of the year. And that's not, it's not hurting us, it's hurting those who we serve, because that money is expended on behalf of services. So, in any event, any other discussion? Roll call vote, please, on the 24-25 proposed budget.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles? Yes. Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans?
Yes.
Ms. Root?
Yes.
Ms. May?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you.
Thank you.
Thank both of you very much, and thank you. Please pass our thanks on to everyone in the department for pulling the budget together, right on top of the audit, so we appreciate that.
Thank you.
At this time, we have the proposed fiscal year 24-25 annual plan. Frances Carley, I believe, she's online.
Hi, yes, I am here.
Are you in recovery after your walk today?
I'm still in my shirt, but I'm here.
Okay, good. Well, thank you for joining us. I know it's been a busy day for you.
And I presented the annual plan last week during the committee of the whole meeting. You should have the full draft document and the goals and objectives as part of the board packet tonight. And one thing that we're working on with communications and will be included in terms of the outreach and the promotion of the annual plan. Once we have that, it's more of a graphic that will be more accessible for individuals receiving services, and so that's how the annual plan will be presented when we send everything out. But if there are any additional questions, I'm happy to take them now.
So, thank you, Frances. We did at our meeting last week, the committee of the whole meeting, we did go through, Frances led us through our goals on administration and service delivery, integrated healthcare, partnerships, advocacy, and community outreach, quality system of care, and staffing and retention. And we appreciated going through that. So we're not going to repeat that tonight, but I think everybody's had an opportunity to, look through the plan. It's something that if you don't have a plan, you don't have goals that can be achieved. So this is a collaboration with the staff and our providers to come to these goals. Do we have a motion?
So moved.
A motion and support. Is there any discussion? Just the one item I want to, just one item I want to mention is that the report does indicate that OCHN, along with others, our providers, serve about 29,000 people annually here, and we collaborate with a variety of multiple community stakeholders, including our Oakland County courts, law enforcement, local hospitals, the Oakland County Health Division, and Oakland County schools, as well as our providers. So we want to thank all those organizations for the service that they provide. So if there's no further discussion on the plan, a roll call vote, please.
Ms. May? Ms. Root?
Yes.
Dr. Hans?
Yes.
Ms. Woodruff?
Yes.
Dr. Guadalupe? Yes. Pastor Jones?
Yes.
Dr. Giles?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yeah.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Next item to be presented by our legal counsel, Kalana Ali, is our PIHP contract, which we received some communication
Yeah, the
about
PIHP.
today, as well as we have had some meetings on this in the past. So Kalana, I know you're online. If you would join us and make your presentation.
Yes, sir. Thank you. Kalana Ali, legal counsel for OCHN. Today I have before you the fiscal year 25 PIHP contract in the amount of $400 million. I won't go into the minutia, but as it appears on the screen, we are recommending at this time to submit the agreement as amended by OCHN for approval and signature for submission to the department.
Okay? So that is our largest contract at $408,486,819.
You said it way better than me.
I'll move for approval.
Support. A motion and support. Is there any discussion? A roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles? Pastor Jones? Dr. Guadalupe? Ms. Woodruff?
Yes.
Dr. Hans? Ms. Root?
Yes.
Ms. May?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Next, we have contractual matters, and I'll turn it over to John Young, our finance chair, but the first one is CNS anti-stigma, which again was discussed last week.
It was discussed at the committee of the whole last week and unanimously voted, recommended to come forward to the full board, so I'll make the motion for approval.
Support. A motion and support. Is there any discussion? Roll call vote, please.
Mr. Furman?
Yes.
Ms. Root? Dr. Giles?
Yes.
Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Mr. Young?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans? Ms. May? Yes. Mr. Cowan?
Yes.
Motion carries.
Next item is the extend our current contract for legal services with the Rosati, Schultz, Jopik, and Hans Buchler firm, who we have been working with since 2013.
And this one was also fully discussed at the committee of the whole finance committee and was unanimously voted for moving forward. So I'll make the motion for approval.
Motion, and is there support? Support. A motion and support. Is there any discussion? Roll call vote, please.
Ms. May? Dr. Hans? Pastor Jones?
Yes.
Mr. Young?
Yes.
Dr. Guadalupe?
Yes.
Dr. Giles? Ms. Root? Yes. Mr. Furman?
Yes.
Mr. Cowan?
Yes.
Motion carries.
The next item is the Mahalik Group. This was presented by Marquita Massey. The Marquita Group provides technical assistance to us with respect to NCQA quality assurance documentation that we are required to submit. And this is an extension of that contract. The staff reports that they're very pleased with the assistance that they have been provided with and that it's satisfactory in every respect.
This contract was reviewed and unanimously recommended to come forward to the full board today, so I will make the motion for approval.
Support. A motion and a support. Is there any discussion? A roll call vote, please.
Yes.
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 Yes. Thank you. Our last contractual item is contract with Jefferson Wells, also that was presented by Marquita Massey, and this is for providing administration of the Medicaid billing verification audits. Those audits are to be performed in compliance with the Michigan Department of Health and Human Services requirements and standards associated with implementing quality assessment and performance improvement programs.
This contract was reviewed last week at the Committee of the Whole Finance Committee meeting and was unanimously recommended to come forward. So I'll make the motion for approval tonight.
Support.
A motion and support. Is there any discussion? A roll call vote, please.
Yes. Dr. Hans?
Yes.
Ms. Woodruff?
Yes.
Pastor Jones?
Yes.
Mr. Young?
Yes.
Dr. Guadalupe? Yes. Dr. Giles?
Yes.
Ms. Root?
Yes.
Mr. Furman?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. So we are done with that business portion. The next item we have is a consent agenda with our board meeting minutes and also reports and minutes from Recipient Rights Advisory Committee, Committee of the Whole, and CAC meeting minutes.
Move for approval.
Support.
There's no discussion on consent items. There's been a motion and support. All those in favor say aye.
Aye.
All those opposed, the motion carries. We also have two receive and file matters. We have the July finance reports that were submitted by Mr. Franklin last week, and also the SUD strategic plan, which we went over in detail at our meeting last week of the Committee of the Whole. So we're noting for the record that those reports are received and filed by the board. Next, we have board reports. First, the Citizens Advisory Committee. Christina Root.
Thank you. Our August CAC meeting was held on Wednesday, the 21st. The agenda topic that we had the most discussion about was transportation contracts. The main points made in this discussion were that individuals should not experience any interruptions to their transportation services, and that their individual plan of service that is in place should continue to be followed. OCHN staff explained that individuals can speak with their support coordinator about transportation changes, and if they are not getting a response or if there's still confusion, they can then call OCHN customer service. And I invite everyone to look at our meeting minutes from the CAC meeting because just about the whole conversation around transportation was captured in there. So there's many more details if you're interested. And our next meeting is tomorrow at 9:30 a.m. online. Thank you.
Thank you very much. And next is our Recipient Rights Advisory Committee. Dr. Hans.
Yeah, the Recipients' Rights Advisory Committee met on September 5th at 4 p.m. in this room. The key items covered were the annual budget for the Rights Office, which is a little over $2.1 million. There is a 10% increase in that budget, and that is mainly for professional development efforts of the office. Mr. Brown answered a lot of questions about the budget and the concerns of the members, and he was able to give them a better understanding of how the budget is created and how the monies are spent. Ms. Zuzumbo presented the annual plan and the goals for the fiscal 25. Following this, the issues important to the committee were discussed, which is also the same as were discussed, the points that should be brought to the board by the liaison. One of the issues was a strategic plan of the organization should address the need of transition of streamlining the process of access for the school-age children in the IDD population when they transition into adulthood. So apparently the schools don't provide adequate information to the families about the services that are available, and it is hoped that the working group can work on that, and we address that in that format. There were also concerns about the impact of budget deficit on services. This has been an ongoing point that comes up in every meeting, and this was addressed, and people, I hope, were reassured that the services will not be impacted. Vicky Suder discussed the policy review regarding residents' property and funds, and also the rights of individuals in the community settings. The rights update, the site visits are 66.5 completed. The outliers are inpatient and partial hospitalization services, which is very typical, and that is done towards the end of the fiscal year. That report was submitted up to the end of July, so we still have 2 more months of data to discuss. The next meeting is October 1st, which is a Tuesday instead of the usual first Thursday of the month, and that's at 4 p.m. in this building. Thank you.
Thank you very much. And we appreciate the work of both committees. With respect to other business, the only thing I want to mention to the board is that we do have a study session on the 26th. What's our start time? 6 o'clock? Okay. And the main topic will be the transportation changes and implementation of that, which is coming up very shortly. We'll have updates on the rates and budget. We won't have budget changes at that meeting, but if we do have some information, they can at least share if it's good, bad, or indifferent. So those are the 2 primary items. I also want to mention, typically at this time, following other business, we have our CEO's report, but Dana is away for a joyful family matter, but I'm going to let her share that when she gets back. That's not my prerogative. But she'll give her report, I believe, at the study session, her monthly report to us. Is there any other business that board members want to bring up at this time? Okay, there being none. The next item is public comment. The second opportunity for public comment. Is there anyone online?
If you are online and wish to speak for public comment, please raise your hand at this time, and I will call on you. Matt, you can go ahead. You have 3 minutes.
Hello. I spoke to you guys before about the transportation issue, and I'm going to say it again. Transportation is a big issue, and I'm being negatively impacted due to the transportation changes. I've been on the phone with customer service and a few of you guys and other people. They say they're trying to work on it for me. I just want to continually remind you guys that this is still an ongoing issue, and it's not too late for you guys to change your mind or figure out rates that are going to be appropriate for people that are in wheelchairs, because our vans are normally bigger and will cost more to keep that in service. So I just really wanted to remind you that I've called a couple of the other transportation companies, and they said that they were only doing it for vocational services and not CLS services. And my provider is going to be dropping my van for CLS services. So yes, I'm being negatively impacted, and I am working with CMH customer service on this, but I wanted to make sure that you guys know that this is still an ongoing issue. And I'm sure I'm not the only one to be going through this, becoming 10-1. Thank you.
Thank you. Is there anyone else?
Larry, you can go ahead.
Hi, I'm Debbie. Larry's sitting next to me. Matt, thank you for your comment. Everything Matt said, I agree with. I have a question about the transportation. These transportation companies that are supposed to be on this list that I received from MORC or Easter Seals, whatever we'd like to call it, where did they come from? Can anybody answer that for me? Because they weren't vetted, obviously, because I've called all of them. And some of them are restaurants. Some of them are personal homes. It's kind of embarrassing to call them.
Well,
So-
if you could send the list to us, we just don't know what list, Mork or Easter Seals created and where they got the list from.
They got the list from you.
Well, before we jump to conclusions,
Okay,
why don't you send us the list so we have whatever you have and then we can look into it, okay?
okay, attention to,
Our customer service department, please,
Okay.
send whatever list that you were provided to our customer service. It would
like
be.
Matt, I've talked to customer service. And basically, I know I have 3 minutes, so let's make this very short. October the 1st, my son will have no transportation to or from a vocational program. Since January, I have received many letters, gone to webinars, and every time it says, your transportation will not be interrupted. October the 1st, mine's going to be interrupted. So, and I'm very excited that you're having a meeting tomorrow morning. Maybe some of this is going to be resolved because I don't know who's contracting these transportation companies and then giving the list out, and no one will transport a wheelchair at this price. Thank you.
Thank you. Is there anyone else online?
If anyone else wishes to speak to public comment, please raise your hand at this time. No one else online.
Okay. Is there anyone in the audience who wishes to address the board? Being no one, we'll move on from public comment. And again, we thank those comments. And I think Trish has heard the two comments on transportation, and we'll follow up on those promptly because we do have a deadline coming up. All right, at this time, board member comments, and we'll start with Sarah May.
No comment.
Okay.
Thank you. I want to congratulate Vicki Suter. Her service to this organization and to the people in various capacities is truly inspiring. I am not sure how she does it, and she's always ready for whatever discussion comes up and has just the skill to reassure people. I have seen it firsthand in RAC, and I really am impressed and very inspired by her. Thank you.
Thank you. Yvette?
I'll echo Dr. Hahn's sentiments to Vicki. They don't build them like they used to. People don't stay around for 35 years, and thank you for your dedication to the people that we serve. I know it's been rewarding for you, and I'm glad that you're still here and that you're not leaving at this point.
Let me also sort of echo, but I'd like to really thank Sabrina for her discussion with us today on her recovery. I tell you what, that was very, very inspirational, and I thought she's an example of that. If she can, someone else can as well. And so I thought that that presentation was very good and rewarding. Secondly, you know, I've said since we have such a great staff here, very helpful, very informative, very knowledgeable, and today we celebrated one of the examples, 35 years. I tell you what, you make me proud to be on this side. So thank you so very, very much for what you do. I was in a meeting earlier today, and they continued to talk about, at every discussion, a number of times they mentioned OCHN, 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 and it's people like you that give us that great name in the community, and for people to know that this staff is really doing the job and doing the work beyond the scenes, in front of, and even out of the way. So thank you, and thanks to the staff, and thanks for the reports today.
3 quick thank yous. Thank you, Vicki, for all your service and dedication. Thanks to our speaker for that story. It truly was inspiring. And also thanks to the finance team for all the work over the past month and the next month in advance.
Ms. Adam?
Vicki, I'd like to echo the comments of many of my board members that just spoke tonight. Known you for many years, working with you on various committees, and the passion for the people that we serve is so evident in whatever work you do, whatever role you're inhabiting in that moment, and it is very much appreciated and very much evident to whoever you interact with. So thank you, and also thank you to Sabrina for her inspiring story, and thank you for the work of all the staff that put the presentations together tonight. Thanks so much.
Thank you very much.
A couple comments from me. The first one, I just want to remind everyone here at our tables, board members, OCHN staff, that as a Medicaid-funded organization, we're supposed to be the safety net for the community, right? So even if only one voice out of 100 is saying that they're being negatively impacted or struggling, we need to be there for that one voice, right? And I'm applying that to our transportation conversation. So I know we say 60% of the providers, are going to see benefits from these changes. There's still, even if it's just a few, right, there's still some people who are concerned, and it sounds like, who are struggling with the change. So just wanted to make that reminder. And Vicki, I really, really mean it when I say, as a youngish professional, I aspire to be an expert in my field the way that I see you as an expert. And I truly do see you that way, because I was on the RRAC for a year, so gotten to work a little bit closer with you. But congratulations, and thanks so much for everything that you do.
Dr. Jones?
All right, I promise not to keep you long. I also wanted to say thank you to Mrs. Suter. Over 3 decades, that's all I can say, of service. Thank you so much. And thanks to the finance team who comes up each time almost with one of our largest problems, and you do your best to explain and try to make the community at ease when we know. How can you be at ease when you don't know what to expect? So thanks so much for what you do, and I apologize to Ms. Sabrina that I missed your presentation, but it sounds like it was pretty amazing. Thank you all.
Dr. Guadalupe?
Congratulations, Vicki. An amazing 35 years. That's just awesome. So thank you for that, for your service. I also wanted to mention the great work I'm seeing on whoever's, I should know this, but whoever's doing the social media. It's looking great. Just on Facebook recently with highlighting like co-responders for Co-Responder Week, acknowledging Hispanic Heritage Month. I think all these things are important for the community to see the great things that are being facilitated. focused on diversity just to kind of show that everyone belongs. So that's great. And then a huge thanks to those that were at the Walk a Mile in My Shoes event today who traveled to and from Lansing and are here late at a board meeting. So thank you to those that spent your day doing that, and that advocacy work is huge. Thank you.
I want to thank the board for all their work with respect to this meeting. It was a big night in terms of the budget, the PHIP contract, and other matters, our annual plan. So that everybody sees all the work that goes into this from our staff and others, and we appreciate that. So I've said enough. Vicki, thank you. Keep on going. And unless there's any other business, we stand adjourned.